Suarez, and I'll be going to perform the positioning of the facial bones. The first is the reverse Waters method, that acanthoparietal projection, and the second is the facial bone modified Waters, and the third is the Waters method, that parieto-acanthial projection, and lastly is the facial bone, that lateral projection.
First projection that I will be performing is the lateral projection of the facial bone. When positioning the patient, make sure that the MSP and IOM should parallel to IR, and the IPL should perpendicular to IR, and the CR is perpendicular to zygoma and malar bone. And make sure that the image is superimposed to facial bones and superimposed mandibular rami and orbital roofs. Second projection is the Waters method of the parieto-acanthial projection. So make sure that the patient is in the prone positioning, and the MSP and MML perpendicular to IR, and OML 37 degree to IR, and nose is half by half and 1.9 centimeter away from the IR, and it is perpendicular to acanthion. Then the best image CR is perpendicular to acanthion, the exit, and make sure that the image is the best projection for facial bones, and the pictus regis below the maxillae, orbits maxillae, and zygomatic arcs. Then the rationale used is the blowout of fractures. So third positioning is the modified Waters. When positioning the patient, make sure that the MSP and MML perpendicular to IR, and OMM is 65 degree to IR, and perpendicular to acanthion, the exit. Make sure that the image of the facial bone are with less axial angulation, and petrous ridges below the inferior border or orbits. Last positioning is the reverse Waters method of the acanthoparietal projection. Make sure that the MSP and MML perpendicular to IR, and OML is 37 degree to IR, and then chin up, then perpendicular to acanthion, the entrance. Make sure that the image evaluation is the superior facial bone, same as the original of the Waters, but the image is magnified. The rationale for use is for patient who cannot be placed in the prone position.